theanswer.com. Now, from the Signature Bank Studios, this is Chicago's Morning Answer with Dan Proft on AM 560. The Answer.
Top of the morning, Dan Proft here. Piece by Charles Fane Lehman in the Wall Street Journal recently on marijuana. Marijuana, we're revisiting it. Some are. Some just want to just plow ahead because there's money in it. And I'm talking mainly about the politicians here, in addition to the obvious interested parties, those in the industry. Whether to loosen the government's ultimate controls on marijuana is something that Trump inherited from Biden. Under the law currently, marijuana is a Schedule I substance, meaning it has no accepted medical use and a high potential for abuse. Biden initiated a process to move it to Schedule III, labeling it with a medicine with only moderate abuse potential. And now Trump has to decide whether or not to reschedule marijuana or not. Charles Fane Lehman argues that he shouldn't. Though rescheduling wouldn't mean legalization, it would still be a federally controlled substance. It also wouldn't necessarily mean increasing the medical availability of it. Medical cannabis is legal in 40 states. The primary effect of rescheduling would be a tax break to fuel the growth of state legal marijuana businesses. There's a provision which provides businesses can't deduct the cost of trafficking Schedule I or II controlled substances, but that's not the case for Schedule III. And what of legalization in those 40 states mentioned? What do we know? He argues legalization has increased rates of marijuana addiction, typically called marijuana use disorder, including rates of heavy use among teens. State legal businesses have a profit-motivated reason to nurture addiction. Due to legalization, today's pot is far more potent than it was decades ago. Research links marijuana use, especially in young adulthood, to IQ loss, schizophrenia, heart attacks, strokes, and lung disease. And he argues, does Charles Fane Lehman, legalization is already socially toxic. Research by the Kansas City Fed found it increased homelessness, addiction, and arrest by double-digit percentages. Other research, both on Seattle and Vancouver, British Columbia, find the dispensary proximity causally reduces property values. And there's also the odor, which you can pick up on walking around downtown Chicago at any time of day. The rescheduling decision rests with DOJ and HHS. And we'll see what President Trump's decide. This is something that Alex Berenson was becoming sort of famous for, high profile on this topic when pre-COVID, I should say, when he started writing about the topic, based in significant measure, as I recall, on the experience that his wife had as an emergency room physician and seeing instances of marijuana-induced psychosis in young people. So maybe as we're in the post-COVID era, not that we're done talking about COVID and the aftermath, but it is time to revisit some of this as well as it becomes more and more popularized and perhaps less and less scrutinized. For more on this topic and others, pleased to be joined by the aforesaid Alex Berenson, of course, the author of Pandemia, How Coronavirus Hysteria Took Over Our Government Rights and Lives, and his popular Substack, which you can subscribe to at alexandberenson.substack.com, is entitled Unreported Truths. Alex, thanks for joining us again. Appreciate it.
Thanks for having me. Before they hated me for COVID and saying we shouldn't lock down, the hard left hated me for saying that cannabis was not a miracle cure for everything under the sun.
Such a contrarian you are, yes. So where, probably 6 or 7 years after you started writing frequently about this topic, where are we, do you think?
Well, I think, Charles Fane Lehman summed it up. What's interesting is legalization has proven to be such a mess. It's done essentially nothing good, and it actually, strangely enough, hasn't really even, from the legalizer's point of view, done anything good, because it's opened a few people who had never used marijuana or hadn't used marijuana in a long time, hadn't used cannabis in a long time. Maybe they used it in college in the 80s or 90s or even 70s. And some of those people have tried the new cannabis, have tried, THC extracts, and found just how unpleasant high potency THC can be for a lot of people, because it is so strong. And when you're using, a 95% THC vape, if you're not used to that, it's basically a hallucinogen for you. It is not a mild intoxicant by any means. So legalization has more or less failed, but I don't know that we're going back. If we're not, I don't think we're going to go back for a long time. It's one of these things people sort of made up their minds that, based on a bunch of false pretenses about how cannabis was really a powerful medicine that people should be allowed to take, and how we were putting a lot of, Black people in jail for marijuana possession, neither of which were true at all, and certainly outside the South. The second was not true and has not been true for several decades. And so they don't want to think about it anymore. And, they see a dispensary here, a dispensary there, unless their children get stuck in addiction, or, someone they know gets stuck in addiction, and which sometimes does come with psychosis, and in the worst cases can actually, lead to schizophrenia, which is a permanent psychotic disorder, which is not something I would wish on my, worst enemy. People just aren't thinking about it that much. So there's this group of people who are pushing for rescheduling. They're pushing for full federal legalization. I don't think full federal legalization is in the cards anytime soon. Rescheduling might be. Rescheduling is sort of ridiculous because, on the one hand, no, marijuana or cannabis is not as unsafe as heroin. On the other hand, it's a smoked product, right? So it can't really be a medicine because you don't smoke your medicine. No doctor would ever prescribe tobacco for somebody, even if it, increases alertness. We don't smoke medicine. So from that point of view, cannabis should be a Schedule I substance. But the 1 versus 3, except for this issue about being able to deduct taxes, is sort of secondary to the broader cultural fight and the broader, state fights over legalization.
Now, just a point of order. I smoke cigars when I play golf, and I find not only they're enjoyable and relaxing, but also they sort of serve as a swing aid to keep me on plane when I take the club away. So, I'm just challenging your medical characterization of tobacco in that narrow instance.
There you go.
All right. Now you've been called out, not to play devil's advocate. You and Lehman were both called out by Jeremy Berkey, who's the editor of this outlet called Cultivated, which is a pro marijuana legalization. Yep. Here's what he writes in response to this Wall Street Journal piece and some of what you said. It's important to note that we do have a clear example of a federally coherent cannabis policy in Canada, which legalized in 2018. While the industry is still a work in progress for many companies and consumers, the sky has not fallen. The vast majority of people who walk around downtown Toronto or midtown Manhattan, places like that writers like Lehman or Alex Berenson maintain are filled with crime and disorder spurred by legalization, aren't thinking about cannabis at all unless they're specifically seeking it out or happen to pass by a dispensary. What the also goes on said in the Wall Street Journal piece are the clear benefits of legalization, including capturing tax revenue from criminal organizations, fixing the sordid history of racialized policing, and creating economic opportunities for communities, often minorities or in low-income zip codes that were punished for cannabis in the first place.
So what he's saying is the sky hasn't fallen. And of course, the sky hasn't fallen, right? Cannabis
not the standard.
Yeah, right. That's not the standard. Cannabis is not methamphetamine. Okay, it's not fentanyl. Okay, it's a bad drug, but it's not the worst drug. Let's not pretend it is, right? But the question is not whether cannabis, legalization is going to produce, the end of civilization. The question is whether it's a good idea on balance. And it's clearly proven not to be a good idea on balance. And by the way, one other thing that people like Jeremy don't acknowledge is that the illicit market remains huge in legalized states, okay? Because what unfortunately has happened is the new high potency stuff, I mean, this is always true, it's become more true. Again, it's not that attractive to casual users, but it is very attractive and very addictive for people who use heavily. And guess what? It also interferes with your ability to work. Mm-hmm. So those people just want as much cannabis as possible at the lowest possible price. And the illicit market delivers that because it doesn't have the cost of regulation or insurance or storefronts or any of that. And guess what? In legal states, there's essentially no law enforcement against those people. So they don't have to worry about the cost of incarceration or really having to hide their, operations at all. So they can deliver cheaply. And so what you get is the worst of all worlds. You get this kind of like floundering legal market as well as a big illicit market. And let me add one thing that Charles didn't talk about and that I don't talk about enough, which is what's called Delta 8 THC, Delta 10 THC. There are slightly chemically different versions of THC, which is the main psychoactive molecule in cannabis, that are essentially now federally legal due to something that we did in 2018, sort of by accident, although I think the industry knew what it was doing, where those non-Delta 9 THC products are legal basically everywhere, including in states that haven't legalized at all. And that needs to change. And I would think even the industry would think that needs to change because those products are totally unregulated at the state and the federal level.
It seems to me that this is another instance, though, where we have a hard time getting the straight dope, if you will, from the medical community. It's just
you're absolutely right.
It becomes too political. It's too popular. It's too political. The interests are too powerful for too many medical professionals to tell the truth. I mean, we see this playing out over and over again with respect to public health matters.
You're absolutely right. I mean, psychiatrists know how bad this stuff is. They're the ones, psychiatrists and ER docs are the ones who see and Jackie is a forensic psychiatrist, meaning that she actually sees people who are charged.
Your wife.
Cases.
Your
yes.
wife. Yeah.
So she she sees the sort of downstream effects. But yeah, they haven't wanted to talk about this at all because the legalizing community always says, well, this is a racist issue. Yeah. And if you talk about the truth about how, problematic cannabis can be, you're just a racist.
Right. And if you don't support vaccine mandates, then a disproportionate percentage of minorities will die, of the people who will die, and you're a racist. I mean, it's always just, we know what the conclusion is. It's just different ways to get to it.
Yes, absolutely right.
And so, speaking of that too, you wrote about this, and we talked about it on this show too, because it was just so grotesque. This pediatrician in Texas that politicized the Texas floods and the kids who were killed in those floods by basically saying, because you didn't believe it, because these people were Christians and ostensibly conservatives, even though they were, 8 and 9-year-olds, they didn't sufficiently believe in climate change enough, so they got what they deserved. That's essentially what this pediatrician in Houston said. Yeah. And then she was sort of relieved of her duty, at least temporarily. But I mean, it speaks to, if this was a one-off, I wouldn't make such a big deal about it. But because of our experience in these big public health issues, and because climate changes and gun violence, the public health leadership tries to turn into public health issues too, you have to address it because it's more of the intellectual corruption of the profession.
Yes, and it's funny you mention that because I've been getting emails from other parents, including one in the Chicago area that I need to follow up on, about pediatricians who've just been so stunningly negative, and frequently dumped, kids whose parents, have any questions about the vaccine schedule, or, in one case, a parent said, well, my son went in for a routine, examination, annual check, and all of a sudden he's getting a questionnaire, basically a mental health questionnaire. This is an 11-year-old. Did you threaten to, or do you consider? Have you ever considered killing yourself? And it's like, well, what are you doing? And if you're gonna look, I understand sometimes mental health screening is appropriate, right? Certainly, if a child's expressed any discomfort, or if a parent has done that, but it shouldn't. I mean, that's a weird question to ask an 11-year-old who hasn't raised an issue. And if you're going to do it, you need to tell the parents, right? So I think in general with pediatricians, they've sort of gotten sideways with parents in ways that are really not. It's not in the interest of the profession or the family, and it is what you say. It's medicine sort of getting involved outside its lanes and trying to substitute its judgment, or the judgment of some leftist practitioners, on bigger social issues.
Well, right. I mean, we've covered stories on this show. Parents. I mean, there's these anecdotal experiences where the kid goes in for a checkup, parent leaves the room. They're asked if there's a gun in the house,
right.
and in one instance, then a pediatrician contacted DCFS. I mean, what? Right? What is the basis of doing that?
Right. If the child says, "Look, Daddy was playing with the gun in front of me,"
that's different.
That's different. But what are you doing without any evidence that there's any risk or harm? Having a gun in your house. Look, a pediatrician may not like that, but that's a reasonable decision for an adult to make, and they're then responsible for taking care of that that weapon properly. And by the way, just to sort of go full circle, some of these same pediatricians will then say that routine drug screening for pregnant women is an invasion of civil liberties. Well, why? Because again, that's more likely to capture Black or Hispanic parents. But by the way, it's very clear that parental drug use is a serious risk for kids, even cannabis. So it comes down to, well, this is behavior that I think is okay, or the people doing it are people that I sympathize with.
Right.
So I don't care about that. But having it done, maybe you're more likely to be a white person who has a gun. So that's more problematic for me.
One other piece that you wrote about at your Substack, again, Unreported Truths, I thought was interesting, too, from a different perspective with respect to the medical profession. And that was sort of alignment of interests, and where perhaps there are instances where what the medical establishment, as it's currently constituted, has become, there are misalignments between the doctor's incentives and the patient's incentives, and that becomes a real problem when you're trying to get proper care, not political, but just in terms of proper medical care on a medical basis. And you told the story of your mom dealing with having to get cataract surgery, and I thought it was illustrative of the problem.
Or being told that she needed cataract surgery when she probably doesn't. And,
yeah.
And it's, again, interesting you bring this up, because I got a follow-up email from someone who works for a company that makes these corrective lenses. And he sort of walked me through the economics of this, from manufacture to inserting the lens in the eye. And it is incredible how much money is made at every step of the process. And unfortunately, doctors are human beings, and some of them are going to be financially motivated. I'm not saying that, my mom might not benefit from cataract surgery on the margins, but does she actually need it? No. And does it come with risk? Yes. But is the surgeon financially incentivized to do it? Yeah, absolutely. It's very clear. So, this is, by the way, I do think that, with COVID over, I've written a lot of different things on Unreported Truths in the last, few months, year or two. But I do feel like there's a potential for me to, and I said this to readers a couple of days ago, become sort of like the Matt Taibbi of medicine, where I'm writing, countercultural takes, but informed, and with the help of people in the profession who see how, problematic so many things are right now, and don't feel they have anywhere else to turn to tell, what they're seeing. And it seems like from the reader response I'm getting, people really want me to do that. So I'm definitely going to continue to push down that road.
All right. And you're going to get that content at content at Unreported Truths. That's Alex Berenson's Substack, alexberenson.substack.com. Again, his book, Pandemia, How Coronavirus Hysteria Took Over Our Government, Rights, and Lives. And one other thing, actually, speaking of books, you also authored a series of spy novels. Maybe some people don't know this as well, right?
Yes. The first one came out in 2006. It's called The Faithful Spy. The main character is John Wells. I don't know how much time we have, but there's like something kind of interesting happened with Mandy Patinkin.
Exactly. Well, that's exactly where I want to go, because I play this. We discussed Mandy Patinkin's rant yesterday on the show, actually, and I mentioned Saul Berenson, of course, in addition to Inigo Montoya. But you created Saul Berenson?
Well, so it's okay. This is complicated, and we really should do it over a different interview where we have more time.
Okay.
The Homeland guys created 24 before they created Homeland. Okay?
Yeah.
Homeland is actually named after an Israeli series also called Homeland, and supposedly that's where the intellectual property came from. I would urge anyone who wants to see where Homeland really came from to read The Faithful Spy, which is the original John Wells novel, which came out in 2006, and to watch season 1 of Homeland. It's not an accident or a coincidence that Saul Berenson is named Saul Berenson and I'm named Alex Berenson. I would go into it more, but it would take a little while to explain. But I know those guys, and it got complicated. But when I say that Saul Berenson is Ellis Schaefer, you can, in the John Wells novel.
Your character, yeah.
Yes, the character I created, you can read it and see for yourself. You will see.
That's fascinating. Okay, now I'm going to read it because I'm fascinated by this now, and I was a big Homeland fan, and I read Alex Kaplan's books too.
Yep.
So that's okay. So this is really interesting. Yeah, you're an interesting cat. You're all over the place doing interesting things.
Well, I've tried to pay the bills in a number of different ways.
Well, it's good. You can't just have your wife's doing the Lord's work there. You got to make some cash to contribute, of course.
There you go.
Alex Berenson, thanks so much as always. Appreciate your time.
Yeah, thanks for having me.
And he joined us on the Turnkey.Pro answer line.
It's what Chicago is talking about. It's Chicago's Morning Answer with Dan and Amy on AM 560. The Answer.
For months, you've been hearing ads about Virago immune support. I have to tell you, this stuff is for real.